Hi everyone, it's Dr. Carrie from Lifetime Health and Wellness, and this is our It Takes a Village series here with
Dr. Michelle.
and Mindee.
Welcome. Thank you so much for having me.
So Mindee, tell us a little bit about who you are, what you do.
I'm a Rush Copley midwife. I worked there for the past couple of years. Very happy to have the opportunity to be there. I've been in OB for 20 years and went back to school because I just felt like there just has to be a different way and another way to do birth and support women and support their families. And I ended up here right back in my hometown. I worked at Rush University for 18 years, and then I came here.
That's awesome. I think it's great to let people who are planning to have a baby just get a little bit of knowledge as far as your background. And we would love to know just what sets you apart. There are other hospitals out there that have midwives, but I know there's certified nurse midwives, professional midwives. If you could just clarify a little bit and just, what makes you guys unique.
What is a midwife, for our people that don't know?
Yes. And it's a very common thing to ask. I've been asked that a lot of times, even just from my friends who were asking, where are you going to work? What is your setting? How come you weren't around when I had my baby? Those kind of things come up too. I'm a midwife who went back to school. I was also a nurse, and I support women and families in a hospital setting. There are midwives who support home birth and the community setting. We all kind of work together to support and guide and help people achieve the birth and the support that they need. My navigation and my kind of comfort, my area that I really wanted to concentrate on was bringing those things that have to do with just the hospital aspect, but bringing it down to that it doesn't have to be so medical, and supporting people in a hospital setting and taking out that fear, that unknown, and how can we help you be empowered to ask questions, be a part of your care, and how can we do that and be a part of that versus telling you and making you do X, Y, and
Z. Got it. How soon do you start seeing the women? Is there a certain break-off point where you don't accept them, like a certain stage in their pregnancy or something like that?
We usually start seeing patients around 8 to 10 weeks. Sometimes we're in contact with them for various reasons. If they have concerns about when their pregnancy started or they're having bleeding, we see them sooner. We establish care to get an idea of where they're coming from into the pregnancy and how we can navigate those first 20 weeks are very different from the last 20 weeks, and supporting and coming up with a plan that guides them through the entire pregnancy.
Cool. No, that's awesome. That is really cool. And just like we have our village of people that we rely on to help us with, bottom line is we are guides. All of us, we're guides to help people have the best birth and what they're looking for. But it takes different experts in the field to be able to achieve that. Just like having a plan, like a birth plan, it's a great idea. You have to be adaptable, but it's nice to know that there are professionals like you, and I know that there's a team of how many of you are over at Rush?
So there's 4 of us now, and we have varying backgrounds and experiences, but we all come together collectively and support the same mission for our patients as far as how can we be there to support them, how can we listen to their needs and have that conversation and have them be comfortable to ask more questions, and how can we integrate their beliefs, their cultures, their past experiences, because that does greatly impact one pregnancy to the next, or even how they came into this pregnancy. We're there to listen and to really figure out what we can do to help and support.
I think that's huge. Women and moms, like sometimes they don't feel like they're just being heard, so I think it's great that, without judgment, they're able to place their comfort and trust, in someone like you, because that's going to overall, keep them more calm and not so fear-based, so that they can achieve ultimately what they want. So that's incredible.
Or they don't feel as overwhelmed, whether it's like throughout the pregnancy or even like during labor and delivery, there's another shoulder to lean on, and you guys know the ins and the outs and the different doctors and nurses, and, kind of being that liaison has got to be really kind of comforting for those moms and for the dads.
Yeah, we have our office staff with a great group of support staff also. Our appointments, our initial OB appointment is an hour, and we cherish that hour because we want to have that moment where, yes, we do the medical part and vital signs and history, but it's also what's not in the computer. That's just as important. Our appointments after that are 30 minutes, and even if the whole entire baby exam takes 5 minutes, you have 25 minutes of our time and talk about that next appointment, talk about where we were, where we're headed, things that come up. And you had talked about the birth plan and preferences, and we integrate that not just in one appointment, but over time, because things change and things that come up unexpectedly. We want to be able to give our patients and their families and support as much time to process things if it doesn't quite go the way that they had thought, or even the way that we had thought it was going to go.
Mm-hmm. Yeah, that's awesome. That's great.
Yeah, so you guys basically see people 90% longer than a typical medical office visit. I mean, that's a big deal. Again, just getting that quality of care out. And sometimes, like you said, things change, and you want to be able to have the time and be able to connect, with them. And I know that we have worked together, our office in Rush Copley, and just being able to support, because if ultimately there's a certain goal, we can't do what you do, and and vice versa. So it's great that you guys have ways to assess these moms throughout their pregnancy, and then similarly, we have our ways of assessing the nervous system and making sure that there's the least amount of stress stuck on there so that they can have the birth that they want.
Yes, I have personal experience with chiropractic care. I was an athlete. I saw from very early on how that helped me kind of change, and if I had things that weren't quite right or injuries here and there. And we have women along the way, hip problems, back problems. While it is common, I don't feel like it should be just dismissed as, oh, this is the way it has to be, or you have to put up with it or suffer through it. There's things that, we try and do in our office and try and help with, but the support system, like you had said, it really does help to have somebody who has a different set of eyes and expertise to say, okay, I see this, but let's try this, and kind of putting that together. And so I appreciate all of the support that we work together with too, even in my short years.
Yes, no, for sure. Everybody has a different lens that they focus with. So yeah, that's another reason like we're doing the Village series, right? Because it takes everybody to, support those moms and those parents and the babies. And yeah, this is just great.
And then just finally, do you have any just top tips, for women who are looking to get pregnant, or maybe they're newly pregnant, just any parting words of wisdom or advice?
Trust your instincts, and really seek out those that are supporting you versus spectating your pregnancy. Be involved, ask questions. I've even had it come about where even people seeing me, if we're not a right fit, sometimes that does happen, and there are people out there. There's always somebody that can support a birth in a safe way, in a supportive way, and achieving those goals that that person has and that family has. There is somebody out there, and I'm glad to say that there are more people out there than there were before. And over the 20 years I've been in OB, it's changed greatly. And even doing a series like this, talking about the support and not it be this crunchy granola kind of voodoo, kind of like atmosphere. It really brings it into how valid all of these support systems are and how we work together to help and achieve a pregnancy or support somebody through a pregnancy.
Yeah,
that's great.
Awesome.
We can end it on that note. Yeah. Way to nail that one home, Mindee.
Yeah. Well, thank you so much for being on with us, and we look forward to working with you, just helping to support our community.
Thank you. Thank you again so much for this opportunity.
Yeah.